to be a example of what you can expect for your extraoral exam. We've got our patient here. I'm going to run through the processes that you're going to practice on Wednesday and then test on Thursday. So I'm going to go through my processes. I'm not going to 100% guarantee that your process will look exactly like mine. I'm going to go through as close to the step-by-steps that you guys have, but please be looking over your process evaluation form. If you have any questions about what to do or what to check or what the structure is, please let me know. But we're going to follow it as close as possible to this sequence that I'm going to show and demonstrate right here, okay? All right, so first of all, when I get my patient back, actually, we're going to take a look at what you're going to set out. Let's look at that really quick. So really all you're going to need for this assessment is a patient bib. You're going to grab a bib clip. We're going to use disposable mirrors. You'll need a cotton swab and some 2x2s. And that should be your armamentarium. We're going to be in full PPE, and as you can see, your operatories are going to be fully covered as we're going to be working in each other's mouths and on each other. All right, so after I've shown you all that, now before I get started, I'm going to put the bib on my patient. And I'm going to do a thorough hand washing before we get started. So I've got my gown on, I'm going to put my mask on, and I've got my eye protection on and my bonnet. So let's go wash our hands.
Do you have any other I have hatred.
Right, and we'll put some gloves on. I'm going to grab my thighs. And I'm going to explain the procedure to my patient. I will tell them that I'm going to be taking a look at everything outside your mouth first, that this is a routine cancer screening that we do on all of our patients, that I will probably be, touching down their neck. I might be coming down as far as their clavicle here to check for lymph nodes, and I'm going to get their verbal consent that that is okay with them. Is that okay if I take a look? All right. So remember, I was watching my patient from the second I brought her back. We were looking at her gait. I was looking at her breathing. I'm looking at her facial expressions. Does she look anxious? Does she look nervous? We're taking a whole assessment of our patient before we even start this. I'm going to start in front of my patient. I'm going to come around and I'm going to look at her skin, her eyes, her nose, the outside of her lips. Remember those structures, the philtrum, the tubercle, the vermilion borders, the labial commissures. I'm going to maybe move her face side to side, looking to see if any bulges or anything changes as I'm coming in here. I'm going to be looking at her neck as well. Remember, I'm looking for anything that looks out of the ordinary, but I'm also looking for scars. I'm looking for piercings. I'm looking at her, we learned this word, nevi and epaulets. Any kind of moles or freckles that seem to be growing or crusting over or just not looking right. I'm looking at her eyes to check for the color of the sclera of her eyes. I'm going to push her hairline back and really come look around her hairline out of place. I'm looking at her ears, and I'm coming down, and I'm looking at and evaluating her neck as well. All right. After that, I'm going to come behind my patient, and I'm going to ask her to lift her hair up. And we're going to start with the occipital node. So I'm coming back here, and I'm going to kind of lift her hair up. I'm going to look in the hairline a little bit. Before I start, I'm also going to come over here and look behind her ears. Since I have that moment, I'll be behind there again, but I will take that moment to look. Okay, now I'm going to have her lift her hair up again. Thank you, Ms. Pisano. And we're going to palpate for her occipital nodes here on the back. So I'm going to use bimanual palpation, and I'm going to fill at the base of her skull here. I'm going to go all the way up a little bit into her hairline, and then I'm also going to come down a little bit further just to make sure. Very good. Now remember, her hair is up, so this is a great opportunity to also look at the back of her neck and make sure that there aren't any abnormalities towards the back of her neck as well. All right, so now bimanually I'm going to come and I'm going to palpate those post-auricular nodes, and I'm doing it on both sides of my patient. And I'm going to follow around till I get to the pre-auricular nodes on the front. And while I'm also in this region, I'm going to have my patient, since I'm right here at the TMJ, I'm going to have my patient open. I'm going to have them close. I'm going to have them open again and protrude their jaw forward and move their jaw side to side. So we're checking the protrusion, we're checking the lateral excursion, and then I'll have them relax. I'm also at this point might ask my patient to do the 3-finger test, where if they could just take their 3 fingers and make sure they can open as wide as those 3 fingers. So front fingers in, checking that range of motion, right? So now there's a lot we need to check in this head portion. We need to check her masseter muscle. We need to check her mentalis muscle. We also need to check the parotid gland, the submandibular glands, and the sublingual. At the same time, we're going to be checking submental nodes and submandibular nodes. So as I'm filling these muscles and these nodes, I can kind of do the glands, the nodes, and the muscles all at the same time because they're all in the general area. So we just checked the TMJ. I'm going to have my patient bite her teeth together, and I'm going to start by filling this muscle. Y'all tell me what this muscle is. That's right, it's the temporalis muscle, right? A muscle of mastication. I'm going to have her stay biting as I come down, and I'm checking the masseter muscle. I'm going to have my patient relax, and at this point I'm going to just kind of fill again to make sure the parotid gland feels normal, that there's no growth or I don't feel any indurated areas. And we're going to follow it all the way down to kind of check for her submandibular glands and sublingual gland. And I might have my patient just lift her tongue to the roof of her mouth when I do that sublingual gland, as that kind of helps the submandibular and sublingual glands. I don't know if pop's the word, but kind of pop a little bit. All right, my patient can then relax. We're going to check her nodes now. So I'm going to check the submental node. And remember, when we check nodes, a lot of times I'm feeling for that squishy, pea-like little bump that moves around my fingers. And it should be movable. It should be soft. I like to use the jaw and the bone to really push into it and see if it'll roll between my fingers. So for the submandibular glands, I usually have my patient put their chin down a little bit. I take one hand and I push on the tissue under the chin, and then I'm going to take the other hand and I'm going to cup and roll the tissue over her jawline here, and see if I can feel anything roll in my fingers, looking for those submandibular glands. So that was the right submandibular gland. Now I'm going to come over here and check the left in the same way. One hand's kind of pushing the tissue, the other one's rolling. And I can feel one over here. It just rolls right through my fingers. Again, I'm looking for it to be movable. If it felt hard or fixed on the bone, then that might be something a little bit more concerning. But I want to make sure it's movable, and I want to ask my patient, is that sensitive or uncomfortable? Okay. So once we got her lymph nodes all checked, her glands checked, and her muscles palpated, I'm going to go down to her neck. So I'm going to have my patient turn to the left. I'm going to have her put her chin down. And now I'm going to feel for the sternocleidomastoid muscle. I'm also going to go all the way to her supraclavicular nodes. And then I'm going to feel her cervical pre and post-cervical nodes. So notice how when she turns her head to the side, her sternocleidomastoid muscle kind of just really pops. That's why I have them turn to the side and down. So I'm going to come up kind of close to her ear, and I've got my fingers in the front, I've got my thumb in the back, and we're going to roll down this muscle, front to back, front to back. I'm feeling both sides of it. And then I'm going to come feel those cervical muscles along the nodes along the neck. So in front of the muscle and behind the muscle. I'm also going to tell my patient that I'm going to come right here to her clavicle, and I'm going to palpate above, and I'm going to roll my fingers along that clavicle to make sure there aren't any lymph nodes there. We're then going to do the same thing on the other side.
It takes a little longer than the average. Like an average consultation, probably once, twice a year. Over here to complete the full.
Definitely always ask your patient permission before going into their shirt line, and give them forewarning. Okay. Once I have that, then I'm going to come over here and we're going to check her thyroid, larynx, and trachea. And I'll have my patient look up just a little bit. I'm looking for swelling. Could be uneven, could be across the board, but we're going to just kind of palpate this area. I'm looking for movement of her trachea. If I just kind of hold it and try to move it side to side. If something was going on with the thyroid here, we might feel like it's obstructed, or of course any kind of lumps or bumps. I'm going to have my patient swallow for me, and that will indicate also obstruction, any kind of swelling of the thyroid here. All right. So that's usually the last thing in my process for extraoral exam. I'm going to thank my patient. I'm going to take my gloves off. I'm going to re-sanitize. And I'm going to put some new gloves on for our intraoral exam. Okay.
Stop.
Huh?